Hi, I'm Arun Singh, and today we are diving deep into something that is concerning not only the city, but the entire world, and that is AMR, Antimicrobial Resistance. I'm going to break it down for you in a fun way, but before that, let's ask this gentleman here. Hi, what's your name?
My name is Raj.
Yeah, so we're going to go around and ask people about AMR. So Raj is going to tell us what AMR is.
I have no idea.
I don't know. It sounds like a movie theater. Something new?
All men rise.
Antibiotic resistance?
Have you taken antibiotics ever?
Yeah, I have taken some antibiotics.
We take them only and only if the doctor recommends it and there is no other way to cure the disease.
I really take antibiotics.
Do you think hand washing is related to AMR, and how?
You won't get any bacteria to your hands, okay, because you're washing hands regularly. That's it.
I am running a play school. Like I have been teaching that to the children also in the school that you should wash your hands every time you go to the washroom.
I'm very conscious about these guys. You know how many times I make them wash their
How many
hands?
times do you wash your hands in a day?
Every hour.
Is it your doctor's prescription usually? Do you also take them off the counter?
So I get my doctor's prescription, and every time I'm unwell over there, I just kind of pop them.
For everything the doctors are giving these days, even for a small fever if you have, they give antibiotics.
Mostly by doctor's prescription and sometimes out of the counter as well.
You just go to your local pharmacist, and he'll just say that, oh, bachche ko khasi hai, bukhar hai. He'll just give you the amoxicillin, which is it's not required at first step.
Anything weird you heard about antibiotics?
Whenever you take, you have to complete the antibiotic dose. If you don't, then the bacteria, that the things inside you come after you, like, oh, इसने 3 दिन नहीं खाया, इसकी ऐसी तैसी कर दो.
Take a guess. Which country is called the AMR capital in the world?
I think India.
Is it India? Guessing India.
People keep taking antibiotics without supervision, and this without supervision causes much more antimicrobial resistance. This is going to be a bigger pandemic than what COVID is.
Now that we know how people are just popping antibiotics without knowing the villain AMR in their lives, let me take you to a quick explainer. India's got a bad case of the antibiotic blues. Now imagine a world where antibiotics aren't the miracle solution they once were. AMR is like that one relative who just won't leave, and it's not a guest you want to have over anyway. 410,000 kids under 5 die from pneumonia every year because of AMR. 417 per 1 lakh people are battling infections that used to be easy to treat. Let's decode this super bug spread. Animals are getting so many antibiotics, they are starting to think they are humans. So what is India's battle plan? National program on AMR containment, because containment is key, or so we've heard. Surveillance networks, because someone has to keep an eye on these super bugs. One Health approach, because humans, animals, and the environment are all BFFs. But in conclusion, India's got its work cut out, but with a solid game plan, some serious teamwork, and a dash of humor, we might just kick AMR to the curb. Stay safe, stay informed, and remember, don't pop antibiotics like it's candy.
Welcome to NDTV Dettol's World Health Day special, Antimicrobial Resistance, a silent global threat. Antimicrobial resistance, which is AMR, is an escalating health crisis in India, putting millions of lives at risk. As AMR spreads, it's crucial to understand its causes, far-reaching consequences, and potential solutions. In this eye-opening discussion, our expert panel will explore the complexities of AMR, from its impact on neonatal care to effective prevention strategies, necessary policy reforms, and the vital role of hand hygiene. This is perhaps one of the most important conversations we need to have about how we can tackle the growing threat of AMR together. Joining us today on the show are Dr. Indira Chakravarty, Padma Shri 2014 public health expert, former director of All India AIIMS Public Health, and Chitranjan, National Cancer Institute, Government of India, Professor Neelam Kler, Padma Bhushan 2014. She's also a neonatology, Sir Ganga Ram Hospital, New Delhi. Dr. Narendra Saini, Chairman, AMR Standing Committee, Indian Medical Association. Mr. Ravi Bhatnagar, Director of External Affairs and Partnerships, SOA Reckitt. Sunita George, Principal, Bombay Scottish. Thank you all so much for joining us today on this very, very critical conversation. To begin with, Dr. Chakravarty, I would like to ask you, when we talk about AMR, why is it such a concern? And also looking at it globally, why is it such a concern?
Ambika, I think AMR has gained a lot of importance recently because it is affecting the human beings, the plants, the animals, everyone around. Especially for disease control, the antimicrobial resistance, it not only impacting our everyday diseases, like common diseases, but also the ones which are very critical, like tuberculosis, like HIV, and also the neglected tropical diseases, which is very, very important. And also I think some of the procedures, like, which are life-saving procedures, like chemotherapy, or like cesarean sections, are also getting impacted upon because of this antimicrobial resistance. So I think it's an overall impact. And since it's also impacting on the animals and plants, so it's affecting our food production on a secondary manner, and therefore also food security if you look into it. So I think the impact of antimicrobial resistance is very wide. It's kind of an overall environmental issue, and therefore impacting on the health. And that's why I think today AMR is one of the most critical issues that one has to look upon if you have to remain healthy. So we have to control.
Thank you for putting that so well. Dr. Saini, if I can come to you, what are the significant drivers of AMR and how can we really address it?
AMR, I stand, it is the medicine which we use for killing the microorganisms. It is affecting, rightly said by Madam, it is affecting not only the human being, it is affecting the animals, it is having the crops, and as well as the environment. So we have to tackle all these issues together. A human being also, rational use of, why it happens is because microbes are very small organisms, but they're very smart. If you give them medicine, they get the resistance also. They develop tolerance towards that antimicrobial. So we have to be very careful about that. So what is happening today is an irrational use of antimicrobials. Irrational means whosoever is liking antimicrobials, if his brother has taken antimicrobials, they also start taking the antimicrobials. So judicious use of antimicrobials is very important. Then how much frequency? It's not like paracetamol or any other medicine, like you take it anytime. It has to be taken in a quantity. It has to be taken in a frequency, how many times in a day, and it has to be taken in how many days it has to be taken. So all these things have to be monitored, not only in a man, but it has to be monitored in animals, it has to be monitored in crops. Unfortunately, what is happening is these antimicrobials are used in the crops also, and it is being used abundantly. Tetracycline and sulfonamides are used in the crops. So what is happening is that we are consuming unknowingly in that. And secondly, it is going to the environment. So when it goes to the environment, because you, me, everybody is consuming, so it goes into the water. So you will find the traces of antimicrobials in the water also. And this slow consumption of antimicrobials is giving resistance.
Which is a huge challenge.
And another challenge, antimicrobials, it takes a lot of time to develop antimicrobials. It takes around 10 to 12 years to come into the market. If you see the first antibiotic, it was there in 1928, we got penicillin. But it came to the market in 1941. First consumption of penicillin was used in 1940. So it took around 12 years to come into the market. Same way happened now also. Yeah. It takes a lot of years to come into the antimicrobes in the market. The last antimicrobials which have come in around 2003. Wow. So after 2003, there is a dearth of this. So 1940 to 1960 was a very good era. When we have lots of antimicrobials, they were coming. But now this is now is not there. The discovery of antimicrobials is not there. So, and lots of consumption is there, so antimicrobial resistance is developing. So these two things you combine together, you rightly said, it is going to be a third pandemic.
And we need to address it
immediately.
Dr. Kler, if I can come to you, how does AMR impact neonatal health, especially since you're dealing with children in NICUs, and what can healthcare providers do to mitigate this risk?
Thank you, Ambika, for having me on the panel, and sorry I couldn't join you physically, but I'm happy to join virtually. Well, neonatal infections or bacterial infections in newborn is a huge problem. 20% of morbidity is constituted by neonatal sepsis, that is the bacterial infections. And we lose something like 60,000 newborns annually because of neonatal infections, and most of them are antimicrobial resistant infections. And if you look at the financial burden, you look at the treatment, there is a study from India. If you look at the cost of treatment of a baby with the antimicrobial resistant infection versus non-resistant infection, the cost is something like more than double. It was seen that it was 4.8 lakh versus 1.8 lakh. And if you look at the long-term burden, many of these babies who survive, one is that the mortality is high. Second is that those who survive may be left with long-term sequelae. Like, a baby with meningitis may be left with the neurological sequelae. And then look at the burden of long-term life-adjusted years which the baby will lose because of neurological deficit. And as very rightly put by Dr. Saini, that, in intensive care units, since there is a high risk of infections, antibiotic usage is rampant. And sometimes it is irrational also. And the antibiotics go on for longer time. So there is risk of developing or the rise of antimicrobial resistant bugs. And being the closed spaces, there is risk of infection to the other babies and also in the communities. Yes. Think about it that, if a baby with multi-drug resistant infection goes from one neonatal ICU and gets shifted to another NICU, the same bug goes to another NICU. So there is a risk of transmission of infection in the communities. So there is a short-term economical burden, there is a long-term economical burden, and loss to the family. Hence, the only way out is that we do the prevention, we do the surveillance, and we practice antibiotic stewardship or rational antibiotic use. Unfortunately, regulatory systems in India are not very strict. You can get antibiotics on just a prescription. And even in the hospital also, in the Western society, if I prescribe antibiotic, they have to be signed by the microbiologist or the clinical microbiologist or the infection disease expert. And without 2 or 3 signatures, the antibiotics will not be used, will not be released. And also that, we have first line of treatment, second line of treatment, and then there are certain antibiotics which are in the reserved section. So for using those reserved section, we have to be very, very rational, because as Dr. Saini very rightly put, that we are out of new molecules. Yes. And it's not very likely that we get many new molecules. And unfortunately, in the NICUs, we are faced with gram-negative infections. As you know that there are gram-positive and gram-negative infections, and gram-negative infections are more likely to be multi-drug resistant. Yes. So that's why, the Indian NICUs are facing a problem of multi-drug resistant infections. And unless or until we have very strict regulatory system, we have strict surveillance, and we really practice very, very astute antibiotic stewardship program in all the NICU and in all the hospital, where the clinician, the microbiologist, and the infection ID person are a team who look after. So that, writing and prescribing antibiotics is not just in the hand of one single clinician, but he knows that there is a statutory body, there is somebody who's regulating it. So I think for the future, it is very important that we look at the antibiotic resistant bugs, which are, in every sphere, newborns, adult, old people, it is increasing, and it's going to be one of the major problems. And also a problem for the treatment failure, prolonged hospital stay, and mortality and long-term sequelae.
I think that's really well explained. I think, Ravi, now that Dr. Chakravarty, Dr. Saini and Dr. Kler have explained us, we know how important it is. While we should be, using antibiotics, Ravi, very responsibly, talking about prevention, when Dr. Kler said we need to focus on that. If you can tell us, the impact, what you feel when it comes to something as basic but very critical as hand hygiene as a preventive way so that we can reduce the intake of antibiotics.
Thank you, Ambika. And this subject of AMR is of significant importance to the country, where we have a population of around 1.4, and when I see our 10 years of partnerships have given huge results in terms of increasing the knowledge, attitude, behavior and practice of the school kids on hygiene, where we focused our programs on hygiene at home, hygiene in neighborhood, personal hygiene, hygiene during illness. This is one of the very important times when we also integrate the communication and the nudges on the AMR.
Yeah.
And through our various purpose-led initiatives, we take the messaging on AMR and hygiene to the new moms, to the school teachers, to the schools, to the principals, and to the DIETs, which are the District Institutes of Education and Training. As we know, children and elderly are the most vulnerable groups, so it becomes more responsibility. We focus on germs. We talk about why we should not consume the antibiotics, why we should restrain, why there is a need of the stewardship program, as well as in our modules, in the posters, in the books, in the games, in the hygiene play parks, what we have been doing over the period of time. It's important also to introduce the subjects on the AMR resistance. And there was a big debate, a few days back. I was in the field and with the teams. Should we just talk about the hand hygiene, or should we focus on bathing? Should we talk about the other subjects of hygiene and how big it should be?
Yes.
So, hand washing is the first step. And as Dr. Saini, Dr. Kler, Dr. Indira, after listening to them, I think it's very important. Bathing is also a very, very important subject, because overall you are trying to push the bacteria away.
Yes.
And you are trying to be healthy and hygienic. So more you are hygienic, you are actually focusing on the preventive health.
Absolutely.
If this is not taken care well, then the big plans of the country for the Ayushman Bharat may also crumble. Because there will be more in hospitalization, there will be more inpatients, there will be more drug resistance, there will be more situations where the cost per treatment per patient is going very high.
Yes.
And the tertiary hospitals will be loaded with the more number of subjects or the patients.
Yes.
So if there is a framework which we can come upon for the vulnerable sections, for the kids, for the elderly, so it will be very important, if we can work on. And I can put a promise. So before 2nd of October, when we are meeting again, we were working very closely with the working group of the team of Padma Shris and Padma Bhushan doctors.
Yes.
Definitely along with Dr. Saini and IMA.
Absolutely.
We'll be coming up with something which will be a directional thing, like how to introduce this subject to the kids. Because this needs a whole battery of research.
Absolutely, Ravi. And as you've said kids, Dr. Kler, we spoke about infants. We'll just be going across to Ms. Sunita George, who's a principal, talking about kids as a father, or, as parents very often. I think we struggle with this because they are the first line of caregivers. Dr. Saini, before we go to Dr. George, would you quickly like to tell us something about that?
About kids?
About parents, as caregivers. I think we all hear, as a mother, sometimes I struggle just telling kids, you need to wash your hands.
Rightly said by Mr. Ravi.
Yes.
That hygiene is very important. And hygiene starts from where? If we want to prevent AMR, we don't have the drugs, as I said. We don't have the drugs. So prevention is very important. And prevention starts from where? Prevention starts from home.
Yeah.
So my parent, my mother, my father and the kids. Obviously, the education of kids is through their parents.
Yes.
And so they should know about hygiene. I know in the initial stages of my life, bathing was very important. Somewhere it is gone. So we have to be very careful about it, that our children should take a bath daily, maintains a hygiene in the environment, in the home. And secondly, I will say the clean water is also very important.
So I think that's a very important message for all parents as well. Like, really it starts at home.
And one more thing.
Hanji.
One more thing, that we have to use soap and water. It's just having a bath with a water is not enough. The soap has an important role to play. It takes away my germs on my hand slightly away from that.
Yeah.
And the water wash it away.
So clean water and soap.
So
the
both
right
are
way.
important.
Yes, I think very important point. Thank you, Ms. George, for joining us. A question you'll be talking about AMR. So as a principal, what strategies do you think schools can employ to spread more awareness about antimicrobial resistance, which is AMR, among students, teachers, and the wider community? And how can we work together to promote responsible antibiotic use?
Schools can do a lot, particularly in terms of spreading awareness, because when we're talking today about AMR and I feel it requires a behavioral change. This behavior of popping pills every time you're feeling unwell and taking antibiotics without a doctor's prescription has to change. And when we talk about behavior change, a lot can be done by the schools, particularly because we are impacted the most. We are seeing that children are taking longer to recover from infection, particularly after COVID. And hence it is important that we talk to our children about hygiene. We talk to them about washing their hands after you visiting washrooms. Talk to them about washing hands before they eat food. Also, a lot of awareness has to be created about vaccination, and I think that can become a very important part of the curriculum. On how vaccines help. Also, case study on COVID. I think that's the best case study to talk about the impact and how vaccination has helped the entire country come out of COVID. Similarly, when we talk to children about microorganisms, and we have a topic on microorganisms in grade 6, 7, 8, I think it's important to talk to them about AMR. When we talk to them about antibiotics, we need to talk to them about judicious use of antibiotics, emphasizing that prevention is better than cure, emphasizing the proactive approach rather than reactive approach. I think that is where the schools can play a big role, because habits are formed at a young age, and we interact with children right from the time they're 3.5-year-old. So schools can do a lot in terms of building a healthier and a fitter and a brighter future for our country.
Dr. Indra, we just heard what Ms. George had to say. If I can just ask you about hygiene, since we are talking about the prevention aspect, what Ravi was saying, what Dr. Saini was saying, how can we really bring about that shift when it comes to prevention, where and how, when we're looking at hospitals or communities, or like Ravi was saying, in the vulnerable community?
You see, Ambika, if you look into the importance of AMR now, I think the whole world is looking at it, and Dr. Saini would agree. We have the Global Action Plan, created the gap with the 4 major agencies, WHO, FAO, UNEP, everybody coming in. We have the GLASS, the surveillance system put in place. And as far as I know, 176 countries have already formed national plans. But we must understand that hygiene is the root cause of AMR. It's the root cause. Because of poor hygiene, there is infection. Because there is infection, we use all kinds of drugs against bacteria, against virus, even parasites, against fungus. Just not bacteria. They're all against all the 4 microorganisms. You have to use drugs. So it's a huge use which is coming in, and I think that is where use of this has to. You see, putting a little pun into it. Everybody has a right to live. Now, when we are trying to kill a microorganism, the microorganism wants to live, it doesn't want to die. So the moment a drug comes to kill it, the killer drug, it wants to protect itself. It genetically mutates itself. So there's nothing wrong that the microorganism wants to prevent itself from getting killed. So it's a right of that to live in this world. So I think that way, if we use the drugs, they are going to mutate even further. You use new drugs, they'll again mutate. So they will want to live as long as possible. And that's why I think hygiene is a thing where you have to prevent it right at the root cause. And hand hygiene is most important because through hand we get everything. Surface hygiene is also very important because you touch around everything. Hygiene during respiratory infections is again extremely important. Food hygiene is very, very important, come of these things. So unless we have all of these together, and environmental hygiene of course, to prevent our soil, our water, everything getting. So I think hygiene at every step is very important, and proper hygiene, like hand washing with soap is a must, not just hand washing. And I think if, as Ravi said, if children are taught on these issues, during COVID I remember if you taught children, they still do it. My grandson still does it. Wash hands before he comes to me. So I think if children are taught at this age, they will remember it. So all kinds of hygiene. And I think one more thing I like to add here, it's just not giving drugs to patients, but people also throw away the used material, like the syringes, the medicine bottles, where you have these drugs into the environment. It goes to soil, it goes to the water, it goes from water to the food. So there also the moment these drugs go into the water, which are not being given to human beings, but as a waste, there also whatever microbes are there, they will form a resistance to it. So it's not only just giving it to people through drugs. So, and I think the most important thing is caregivers, hospital caregivers. They are because they are dealing with it all the time. Maximum infections are there because all the patients come there. So I think the caregivers in the hospital have a very, very critical role to play, along with others, the whole community. Otherwise, infection and proper disposal of the waste material is also a very important thing.
I think what you've said is very important. Taking from what Dr. Indira, you've said about the caregivers, Dr. Saini, I would like to come to here to ask you. I mean, of course, prevention is key, hygiene is important, we've spoken about it. But, if you can tell us, how can healthcare providers balance the need to treat infection if also while minimizing the misuse of antibiotics?
One is rightly said by, I think, antibiotic stewardship program.
Okay.
All hospitals should have antibiotic stewardship program. And secondly, utilizing the diagnostics, because lab has an important role to play in curtailing the antimicrobials. If I diagnose well the infection, if I diagnose the antigen or PCR activity, we use the modern system of diagnosing the infection, then it becomes easier because I know I am treating infection or not.
Yes.
Unfortunately, what is happening, 80% of times we do not need antimicrobials, especially in a OPD settings. But you find in all prescriptions, 70% of times they are being used, overuse. As a healthcare professional also we have to learn. We have a responsibility, but sometimes we come under the pressure of a patient. Sometimes we feel that because this infection is prevailing, but diagnosing properly is very important, and for that lab has to be, I think, come up in that direction also. We don't have quality labs, especially for microbiology.
Yeah.
So we have to have a good labs, and then as a doctor I have to emphasize, now the counseling of the patient is also very important for me. Sometimes we don't spend that much of time emphasizing that I am writing this antimicrobial, because other medicine I may stop anytime as a patient. But I have to tell that this is antimicrobial counseling of a patient. You have to take this antimicrobial in a particular weight, in a particular frequency, and for how many days. Escalating and de-escalating. A very, very important step as a clinician for me to curtail this. And secondly, I will say, still we have some infection control practices in the hospital. There are AMR committees there. But unfortunately, for the general public, there is nothing. So community awareness programs are very important. For that, programs like yours, program like Dettol, Swasth Bharat, they are very, very important. The community has to come forward. CSR activity has to come forward in the AMR. Otherwise, we'll be dealing with the pandemic in 2050, where more than 1 crore people will die every year.
I think very, very important points, how doctors need to be more responsible. As a community, what we need to, and most importantly as patients, very often we tell the doctors, oh, give us an antibiotic, we'll heal faster. So I think awareness really is the key. Well, we're taking a really short break. When we return, we'll explore the pivotal role that individuals, schools and communities can play in preventing and addressing antimicrobial resistance. From raising awareness to implementing proactive measures, we'll uncover how collective action can make a powerful difference in combating these growing public health challenges. Welcome back. You're watching a special on NDTV Dettol Banega Swasth India on World Health Day. Ravi, I want to come here to you. You know, we've seen the work Dettol Banega Swasth India does on ground with schools, the communities, talking about the prevention, right? What strategies can be implemented so that children can start learning early and we can combat the effect of AMR?
Because first thing first is it's very important to understand whom we are working. Children are very sensitive. There's a way this problem needs to be addressed with the children. We need to find the child-friendly ways. We need to find the nudges. We need to do more behavioral research. We have a lot of insights from our work from last 10 years on the disease prevention. We are also seeing like there is a huge difference between the states. The education systems are different. I'm very thankful to the new education policy, where there's a lot of focus on the local language and the local content. So earlier, like, it was very, very difficult to focus on, like in English, you are teaching anyone and everyone, or in Hindi. Now, like if you are there in, in Tamil Nadu, you will find like, you have Tamil as a language and English as an alternative to teach the subject. Similar way in Uttarakhand, if you are working, you have Sanskrit also and you have Hindi also to teach, as well as English. So there's a lot of work which is to be done first to understand the problem.
Yes.
Because as per best of my knowledge, baselines do exist, but baselines do exist with the adults. There will be more studies which are required on what's happening on the school floors, because hundreds and millions of germs will be there in the school floors.
Absolutely. Yeah.
There will be more germs in the school toilets. There will be more germs on the hands. There will be more germs on the bodies. There are the more germs when you are actually playing outside. So the relevance of hand washing, the relevance of bathing, the relevance of hygiene as a subject is more and more and more. So, but it's very important to establish it also, because people ask you, what's the proof?
Yes.
So proof point is when you work with the academia, when you work with the research organizations, when you work with the medical associations like IMA and others. So that give you a proof point. So what's the impact of bathing on the AMR? What's the impact of clean surfaces in the schools, in the communities, in the Anganwadis, in the medical centers, in the PHCs, in the wellness centers? So these all need to be studied. And there's a huge role of microbiology in that.
Yes.
And again, kids nowadays, they really love STEM-based education. This is a different India. This is a different Bharat. So when you can bring germs in a non-threatening way to the kids and to their parents, and if you are able to explain to them why do they exist and how we can get rid of them and what are the preventive steps, so that will be something which is fabulous.
Yes.
One of the discussions which I remember when Dr. Saini was training all the leadership who is working under the Dettol Banega Swasth India program across India. There were people from around 22 states in India who attended his programs. So one thing came commonly like, there is a huge risk of bringing germs closer to the kids while you are educating. If there is a way which is non-threatening in nature, by the virtue of that, you can actually show kids what the germs are.
Yeah.
Because there are bioethical considerations also. You actually can't bring the live germs.
Yes.
So what are the ways? Thankfully, with all this AR, VR, technology, you can actually show it to them. They can experience it. They can communicate to the germs. And that's the beginning of the new era where, it's not one-sided communication on the germ kill or on the germs or on this subject, but something which is more meaningful and which is a dialogue.
Yes.
And kids love dialogue. Kids love the superheroes. And if you ask many kids, they say, my superhero is my dad. My superhero is my mom. My superhero is my teacher. My superhero is my maternal aunt. My superhero is my grandparents. We need more superheroes for the kids who can talk to the kids about hygiene as a subject,
Yes.
but definitely in a non-threatening way. And this whole it should be one of the main things which needs to be driven.
Absolutely.
And any brand which is working towards hygiene, maybe it's hand hygiene, maybe it's menstrual hygiene, maybe it's oral hygiene, maybe it's any other kind of hygiene or the environmental hygiene. Every player has a role to play.
Yes.
And it's not just the role of those who are just working on the human health. People who are working on the animal health, people who are working on the plant health, people who are working on the environmental health, everyone have a role in this whole,
Everybody
thinking.
must take that seriously because it is very, very critical. Ravi, I think amazing work what DBSI is doing, and thank you for sharing that. Dr. Kler, just want to come to you. We often talk about the physical impact of AMR, and that's what we've been discussing here in studio. But when we talk about children, how do you think AMR affects the emotional and psychological well-being of kids, particularly those who have experienced, repeated infections or prolonged hospitalizations?
Yeah. Repeated infections would mean more missing the school. And also in a newborn baby, multi-drug resistant infections mean that prolonged stay in the hospital, more financial burden, and also the long-term effects of the multi-drug resistant infections. But in terms of children, I think it impacts them because, if you see children who have repeated infections, whether they are viral infections or they are bacterial infections, it impacts them seriously because they miss their school, they miss their playtime, and that affects them emotionally. And not only that, it affects emotionally the families also. Adding cost, repeatedly going to the hospital or attending the clinics has a negative effect on the children, on the families, on the community. Unfortunately, a lot of time the infection is there, but it is a viral infection. And many a times doctors write viral infection, viral fever, and they prescribe antibiotics. And that's one of the biggest mistakes. Because antibiotics don't treat infection, don't treat the bacterial infection. So viral infections, most of the viral infections do not have treatment. So a viral upper respiratory catarrh, whether you give antibiotics, you don't give antibiotics, take the same time.
Yes.
That has to be engraved not only into the patients, but also into the doctors, because many doctors also overprescribe. I liked the way Dr. Indira said that, hand washing should be our culture. And, many cultures are taught in the school. Children listen to what their teachers say more than what their parents say. So if in the schools you make sure that there is running water and there is soap available, and children before they eat their meals or after they play, they go and wash their hands, I think they will remember it. They'll remember it throughout their life. Also, in context of neonatal infections, most of the neonatal infections are early infections, and early infections come from the mother. And they are basically because of unclean delivery, unclean vaginal examination, and the unclean environment in the delivery room. So I think in 20th century, at least in the delivery room, we should have 24/7 running water and soap available. That should be the minimum.
I think very, very...
And apart from that, sorry.
No, I think very critical points you put out there, Dr. Kler. You were saying something.
Sorry?
You were saying something. Sorry, please go ahead.
No, I was just saying that, in context of mother and newborn, I think it is very, very important that, the delivery rooms have to be very hygienic.
Yes.
24/7 water and soap should be available in them. It should be engraved into the minds of the health workers that, before doing anything, they have to wash their hands. And, not only wash the hands, like in busy NICUs, sometimes we feel that, in every shift, a nurse may have to wash hands something like 200 times if she is washing her hands every time she touches the baby. So at least hand sanitation, that is using of alcohol rub or an antiseptic, is very important. But when the hands are obviously soiled, then they should be washed.
Well,
So
thank
I
you so
guess,
much, Dr. Clare, for explaining us that really well, because, it really starts from there, what you've told us about the mother, also taking care, first point of contact. Briefly, we're running out of time, Dr. Saini, but I want to ask you the role as, as individuals we can play, what steps should be taken to, we've spoken about awareness, but the steps that actually can be taken.
As individual or as family?
Both.
Two things, both important. One is preventing infection. Preventing infection, one. Take care of vaccination, because vaccination prevent infections. We have not talked about it, vaccination. We emphasize on child vaccination, that's there. But we are not emphasizing on adult vaccination also. Adult vaccination is also important because it prevents disease. Secondly, everybody talked about hygiene. Yes, and hygiene is very important. My 5 moments of hand hygiene, they are very important. The third one is, if the infection has occurred, please take the advice of a doctor. Do not take every infection, do not need medicine. And every time when you have a problem, it is not infective. So we have to understand, antibiotics will affect only when there is an infection. And that too, in all infections, they are not required. 70% of times, you do not need antibiotics. And do not pressurize the doctor to take antibiotics. And thirdly, if you have any time, the last time you had somebody has prescribed you antibiotics, do not take that antibiotics because it may not be required now. And when you have been advised antibiotics, then take it judiciously, means number of times in a day when they are asked you, and number of days. Because it's not like paracetamol, once again, okay, you take once in a day, or sometime whenever you have a problem, you take it. Once it is started, it has to be taken for a particular duration, a particular time.
So we have equal responsibility here as individuals and families. Very well said. Dr. Indira, last word to you when it comes to, we've been talking about the misuse of antibiotics, but if I can ask you, what policy changes or interventions do you recommend when it comes to misuse of antibiotics? Briefly, if you can tell
Very
us.
quickly, I think people have been talking, all of us have been talking about hygiene. So I think hygiene education should be very targeted, not just a general thing, as Ravi also mentioned. Very targeted hygiene education for everyone. Hand hygiene, surface hygiene, overall cleaning, bathing, very targeted hygiene education, number one. Number two, overall public health education. So that, it's impacting on the entire environment. So public health education, very important for the people, for the doctors, for the healthcare workers. And I think lastly also proper disposal. Of all used material, so that the drugs do not pollute our environment, which are leftovers, which are thrown away. Those have to be very properly disposed. The medical waste has to be very properly treated so that it doesn't further pollute the environment. And lastly, that will impact the food also, that will impact the water also. So I think all these three are critically important.
Really well explained. Thank you all so much for sharing your expertise. Thank you so much, Dr. Clare and Ms. George, for joining us. Thank you, Ravi, Dr. Indira and Dr. Saini for joining us today. I think it's really critical as individuals as well. As doctors, everybody needs to work. And rightly, like you said, Dr. Saini, about, we cannot let AMR become a pandemic. Thank you all so much for joining us.